So, talking about the international problem that it's the hospitals are suffering from, and their known capacity of handling this situation due to the huge number of suspected cases, which is a normal, thing um, over the world, and much even worse at our countries. Doctor, how do you deal as doctors at the emergencies there with all of this? What kind of cases require staying at home, at the hospital, and what are the ones who should be sent home, and based on what?
So you are right. All healthcare systems in the world have a limited capacity, whether you are in a first world country or in a third world country. So each hospital has a limited capacity. So that's why we try to avoid admission as much as possible, because we will come at a certain point when we don't have capacity to accommodate enough patients, and then sadly a tragedy will happen. So in order to limit the number of admissions to the hospital, so we usually discharge home the well patients. So that means any patient who can stay at home and self-isolate and doesn't require any immediate treatment or management, so we usually advise them to go home and self-isolate. So what we will do, so I will go and take history from the patient to know the patient age and symptoms, and then past medical history. So I will ask him about his underlying medical condition, whether he have hypertension, diabetes, COPD, ischemic heart disease, obesity, malignancy, or any condition of immunosuppression. And then I'll ask him about his medication to see if he's taking any immunosuppressants drug. After that, I will examine the patient. So I will check his vital signs. That means his respiratory rate, his oxygen saturation, his temperature, blood pressure, heart rate, and then I will listen to his chest, do a cardiovascular examination, and then I have to, at this point, I will check if everything is alright. I can send the patient home without even any investigations if I think it's just a common cold, but I will strongly advise the patient to self-isolate for 14 days, him or her and his family. So at some patients I have to do blood tests and chest x-ray, and then I will decide based on all of these factors whether the patients can go home and self-isolate or he needs to come in the hospital. So most of the cases, of the mild cases, we usually discharge the patient home and ask them to self-isolate. This will avoid admissions or keeping patients unnecessarily in the hospital, and then will preserve his capacity. If a patient requires oxygen, that means his oxygen saturation is low. That means the patient needs to stay in the hospital because he is oxygen dependent. And in that case, we have to admit the patient. So it's very important to know that all hospitals also have a capacity of oxygen. So for example, you have a small hospital with a capacity of 3,000 liters of oxygen, and imagine if you are having 200 patients on 10 liters of oxygen, so that's 2,000 liters of oxygen pumped into the hospital. Yeah, so you have a capacity. So we tend to as long as patient is not dependent on oxygen and their breathing is fine on their own, we can usually discharge them home. So if a patient is critically ill, so in that case he will need ITU bed, intensive care unit bed, and all hospitals have a limited number of these beds. If a patient is severely unwell and he needs a ventilator, we also have a limited capacity of these ventilators. So what we do is a step up and a step down approach. So we start with the basic things as long as the patient can handle that. So if we need to give a patient oxygen via any non-invasive ventilation, so just oxygen mask or vessel cannula, that's better. But if the patient is not able to maintain good oxygen saturation, so we will have to sadly do intubation and keep the patient on a ventilator. So once the patient feels all right and we think the patient can um, take normal oxygen, so in that case we will extubate the patient. So in that case we monitor patients really closely, so we can limit the number of ventilators and beds we can use. So the problem is in our countries is even in normal days we usually don't have the capacity for all patients. So imagine if we have this kind of situation that is happening in Italy or USA, um, it will be a catastrophe because we should. Um, what can we do as a doctor? So you have different aspects you have to deal with. You have your ethics and you have your medical legal aspect of the job. So you can't turn a patient away. If the patient needs to come in and he needs to be in oxygen, you can't turn the patient away. But at the same time, you can't take a patient off the oxygen and then let them go home and die. So it's a very, very stressful time. And we try to do everything possible to make use of the resources we have. Um, and that's why we ask the patient for their help. Usually patient is part of the management. So even if we think the patient is moderately unwell, but he still can go home and watch out for himself. So we ask the patient to go home and come back to the hospital only if he develops any severe symptoms, which means shortness of breath. And in that case, we'll have to come in. Even if the patient come back after 3 or 4 days, it will still give us time. So that's 3 or 4 days of a bed we can use for other critically ill patient.